Hello, my name is Lindsey Rylee, and my EBP presentation topic today is on continuous ultrasound. The article that I chose to review for this presentation is titled "The Effects of Therapeutic Ultrasound and Exercise on Pain, Function, and Isokinetic Shoulder Rotator Strength of Patients with Rotator Cuff Disease." The investigators of the study are stated on the slide in front of you, as you can see. This study is considered to have level 1 evidence because it is a double-blinded, randomized, placebo-controlled trial. But however, because the sample size is small, less than 100 subjects, to some it may be considered to be level 2 evidence. The purpose of the study was to see if the therapeutic ultrasound has an effect on pain, functional status, and isokinetic shoulder rotator strength in clients with shoulder pain due to a rotator cuff disease. Researchers also hypothesized that the ultrasound would have an effect, although they didn't specify in the text if this was a positive effect or a negative effect. Participants were included in the study if they met the following criteria: unilateral shoulder pain, limited active range of motion for at least 4 weeks prior to the study, normal passive range of motion of the shoulder, a diagnosis of rotator cuff disease by an MRI, no shoulder physiotherapy in 4 weeks prior to the study, and if they had 2 of the following positive impingement signs: speed, near, or Hawkins tests, or the drop arm, lift off, or supraspinatus isolation tests, where they would experience pain during external rotation and internal rotation. Patients were excluded from the study if they met any of the following criteria: if they had a history of acute trauma, surgery or fracture to or in the proximity of the shoulders, range of motion limitation in the upper extremities, neurological deficit in the upper extremities, an underlying inflammatory rheumatic disease, or finally, any signs of cervical pathologies that might be associated with The study consisted of 22 subjects. There were 11 males and 11 females, and the selection was done randomly by drawing lots. These subjects were treated at the Physical Medicine and Rehabilitation Department of Baskent University Hospital in Adana, Turkey. There were 2 groups, a true ultrasound group and then a control group, which was also known as the sham group. Okay, now I'm going to explain a little bit to you about the intervention that was used in the study. For the true ultrasound group, they received the continuous ultrasound, and it was stated in the text that the intensity that was used was 1.5 watts per centimeter squared, the frequency was 1.1 megahertz, the ERA was 4.1 centimeters squared, and the BNR of the machine was not stated in the text. So the subjects sat in a chair with their arm in their lap and their hands supinated. The therapist applied the transducer head of the machine to the glenohumeral joint, covering an area of about 10 centimeters squared for 5 minutes. With the sham group, the intervention was performed the same exact way, although the ultrasound machine was set to off. After the ultrasound, there were 2 different modalities applied. So they did TENS, and then they applied hot packs to both of the groups for 20 minutes. And then finally, both groups performed 30 minutes of active range and passive range of motion shoulder exercises, and they give some examples in the text: Codman exercises, capsular stretching, rotator cuff, bicep, and deltoid strengthening, as well as some scapulohumeral stability exercises. Okay, so moving on to the results of the study, researchers found that there were no statistically significant results that were found between the true ultrasound group and the sham group. However, the true ultrasound group did show improved ADL scores as evident from the constant Rylee outcome test, and also the pre and post isokinetic measurements that were taken, they found that only the external rotation 60 degrees per second improved post-intervention in both groups. However, this was not statistically significant. They did also find that post-intervention values for the internal rotation measurement 60 degrees and the internal rotation measurement 180 degrees per second did improve in the true ultrasound group in comparison to the sham group. So I guess what they're saying is that the true ultrasound group did improve in their ADL scores and also in the isokinetic internal rotation scores or values in comparison to the sham group. But again, these results were not statistically significant. In conclusion, researchers found that continuous ultrasound therapy, when combined with other modalities, provides no treatment benefits with regard to pain, isokinetic strength, or functional status of the shoulder. Also, they found that the reduction in pain that had occurred during the study may have resulted in the increased ADL performance that was seen in the true ultrasound group, which also could have helped improve their muscle strength, which was seen as I stated previously with the internal rotation of the 60 degree and 180 degree per second. So the strength and the limitations of the study. The strengths included that it was a randomized, double-blinded, placebo-controlled trial, which are often seen as the gold standard in research. Both of the groups were evaluated based on their age, gender, the affected extremity, the stage of rotator cuff pathology, and their symptom duration. Lastly, the results of the study offer a baseline evidence for further research to be conducted in this area. There were a lot of limitations in the study. I'll just name some of them. I guess the main one would probably be that there was a small sample size. They didn't do any power hoc analysis to determine the adequate amount of subjects. Subjects may not have fully understood the pre-intervention isokinetic testing and therefore may not have understood post-intervention testing. Researchers did not analyze subjects' need for analgesics. Further research is needed, as the researchers stated in the text that this was the only known study that was looking at the effects of ultrasound on isokinetic strength. So research is lacking in that area. There was no long-term follow-up testing done. The study didn't look at the effects of only continuous ultrasound, but because other modalities were also used in conjunction with the ultrasound. So this could be seen as intervention bias. And lastly, the use of subjective outcome measures may be viewed as a limitation as well. How these results are relevant or how they apply to the field of occupational therapy is as follows. These results kind of indicate the need for further research that needs to be conducted on this specific condition, so the rotator cuff disease, as well as indicates the need for further research on other common conditions and injuries as well. These results also reinforce the need for more evidence-based research in our field in general. These studies, such as this one, which fails to show statistically significant results for treatment effectiveness, they're still useful in our practice. They allow current practicing OTs to have some form of guidance and insight when investigating different intervention approaches. And finally, these studies also provide a baseline that we can go off of, while at the same time requiring therapists to still continue to use clinical judgment when they're in the process of deciding which intervention or which treatment will best fit the client's needs and wants, while providing those, optimal benefits, even though future research would need to be conducted. So even though these studies that are done may not necessarily support the intervention being investigated, these studies are still very useful in our treatment plans as occupational therapists. Okay, so lastly, how would I plan to use the results from this study? First of all, I would use these results as a baseline for any further research that I would come across regarding the effectiveness of continuous ultrasound in the treatment of the specific condition, which would be rotator cuff injury. So I would use this as a comparison, as a baseline. Also, I would further educate myself about the effectiveness of continuous ultrasound when used by itself versus used in conjunction with other modalities, such as in this particular study they used TENS and then hot packs. And lastly, I would take these results and once again further educate myself in the use and the effectiveness of continuous ultrasound with other common conditions and injuries that we see, which I would be utilizing this evidence-based research in order to provide future clients with best treatment possible that would meet their needs. Okay, well, this concludes my presentation on continuous ultrasound. You can find my reference stated above from the article that I reviewed for this presentation. And that's it. Thank you for listening.